surgery is available in this country too. You don't have to go to Mexico for it. And what we find many times now, I practice in Los Angeles, and near the border, there are patients, some of them just their bodies because they're dead or drop back across the border. Other ones go to emergency rooms and end up in intensive care units when they come back from these places. Because one of the problems, at least in this country, when somebody's picking a plastic surgeon, they can shopping fees some other way, that's great, but at least they have a way to check their credentials. When they go to a foreign country, many times they don't even speak the language. The credentials are not as well regulated as it is in this country. So this, I mean, I went off on this tangent, but it's an important issue.
No, but actually,
it's happening
and now
all
you're
the
just
time.
going to put me on another tangent,
Right.
which is how many patients come in? You're a very well-known plastic surgeon. Obviously, you're not of the discount variety.
No.
But how many patients come into your office? And most of the patients, I assume, come for your expertise, not your prices. But how many people come in and say, "Well, I went to this guy and he's $39.95, like Earl Scheib, no ups, no extras, and he throws in a tummy tuck in. How much can you do it for?" Do you ever see that in an upscale practice like yours?
Well, you do see patients of all sorts, but my practice is fairly well known for the fact that we do a lot of redo surgeries, which were done before. Many of them are sent by plastic surgeons, and those fees are always higher than the average fees because they're more complex procedures. But putting that aside, I have a fairly high, if not quite high, fee schedule. But then again, on the other hand, we do only one major procedure a day. We don't put patients to the production line of doing, 6 operations and then being just one of the 6 that day. And but we do have patients who come in and the fee is too high from them. That's no problem. We charge very little for consultation. At least they did get a consultation as to what could be done for them. They can take that information someplace else. But if they're going to be deciding not on training, not in certification, not on experience, but solely on fee schedule, they're bound to get in a very bad situation. And many of those are the patients that we're doing in my practice as redo patients, which is about 50%, half of my practice. So anyway, do we get patients who come in for whom the fees is on the high side? Absolutely we do. But again, I charge only $200 for a consultation, and I spend 45 minutes with the patient, because we want to make sure they know all the pluses and the negatives, and that's what the book is about also, is to educate people about, so when they go into plastic surgery, they have a full knowledge and understanding what they're getting involved with.
Talk